my whole window, but I'm just give me a second. There we go.
Perfect. So I'm Katie Bishop from the Center for Science in the Public Interest. Today you're going to be hearing from me, also from Julie Ralston-Ioki from the Public Health Law Center, and from Ashley Bell from the Voices for Healthy Kids. Unfortunately, that has the wrong title slide. But she is from Voices for Healthy Kids. I'm going to be giving sort of a brief overview of what's currently going on with healthy foods and beverages in public places. Then we'll be hearing from Julie from the Public Health Law Center to talk about the Randolph-Shepard Act. And finally, you'll be hearing from Ashley Bell to talk about Voices for Healthy Kids, what the initiative is, and how healthy food on government property fits into that. Next slide. And next slide. So having healthy foods and beverages on government property is a lower cost public health strategy that can and is being pursued successfully in more conservative areas of the country. Governments are implementing obesity and chronic disease prevention programs and providing health education, so it's a major contradiction if they're also selling sugar-sweetened beverages, candy, chips, and other unhealthy foods and beverages on their property or serving them through their programs. By increasing healthier options, governments are able to help model healthy behaviors, shape social norms, increase access to healthier options, and provide a more supportive environment for employees, visitors to government property, and participants in government-sponsored programs. I think we've lost the slides again.
Can you see it, Katie? It's there.
No.
No, we're back to the starter slide again, Michelle.
Really?
Mm-hmm.
Yes.
Oh, that's weird. Okay, sorry.
That's okay.
How about now?
Perfect. And we can go to the next slide.
I was going to try to make sure I was muted, but it seems to do away with your slides.
So in addition to all of those other options, we're finding that more and more consumers want healthier options on public property. In a survey by the Snack Food Association, it found that 74% of consumers are trying to eat healthier, 65% are eating specific foods to lose weight, and sales growth of healthier snacks is outpacing sales growth of traditional snacks by 4 to 1. In a recent survey of healthy vending options in the Chicago parks, it found that almost 90% of parkgoers were satisfied with the healthier options, and the leading complaint that researchers heard was actually that the healthy options weren't healthy enough. Next slide. And this is all part of a growing movement. Many states and localities have started to implement policies to improve the foods and beverages on all or some of their public property or through their programs. The policies vary greatly on this map. Some of them are official policies through legislation or through executive order, and then others are more unofficial change, so contract work or regulations or a program through the health department. And again, some of them cover all types of government property, where others just cover a few venues or just cover one agency. Next slide. Some of the highlights from that map are New York City, which was the first major city in the country to have a comprehensive food standards policy covering vending, cafeterias, and institutional feeding. So it covered government buildings, childcare facilities, correctional facilities, after-school programs, senior centers, public hospitals. It really covered a lot of different types of venues. Next, I want to highlight Massachusetts, which was the first state to do an executive order on healthy food on government property. And they actually chose to focus on institutional feeding. So the feeding through state hospitals, through correctional facilities, some of the different feeding programs from elder services or from child and family services. Washington State was the first state to have a comprehensive policy covering vending machines, concession stands, cafeterias, institutional feeding, and meetings and events. That policy was passed in the end of 2013, and they have created their guidelines for all of the different venue types, and they've started implementation. It will be fully implemented by December of 2016. In Washington, D.C., they passed a policy over the summer which covers vending machines, cafeterias, and concessions. It doesn't cover institutional feeding, but they're hoping to get that covered next year. And this was the first official policy to use the nutrition guidelines that came from the federal government, the GSA HHS Health and Sustainability Guidelines. And actually they required that not only do they follow those guidelines, but they actually bumped the percentage healthy up a bit higher than you'd find in the federal guidelines. But we're seeing policies like this all around the country, as you could see from that map. Tennessee issued an executive order to have healthy vending in all of their government buildings. Hernando, Mississippi has had a healthy vending policy since 2006. Kansas City, Missouri passed a healthy vending policy last spring, and Hollywood, Florida just passed a healthy vending policy 2 months ago. So lots of places are taking this on, and we're seeing new policies all the time. Next slide. And many different organizations are also getting involved in this movement. So there are lots of fact sheets and resources that can help you in your work. The Centers for Disease Control and Prevention has made this a major area of focus in their grant making to states and localities. Obviously, the Center for Science and the Public Interest has made this a priority area, as well as the Public Health Law Center and National League of Cities and other organizations. And Ashley, did you want to mention briefly about the Heart Association and Voices for Healthy Kids?
Sure. Thanks, Katie. So I will go into this in quite a bit more detail when I get to my portion of the presentation. But for now, the most important thing for everyone to know is that for the American Heart Association, we've really seen healthier meetings, healthy vending, healthy service on government property as an initial way from a policy change perspective to really make a difference in helping people make healthier choices with regards to the foods they're eating and the beverages they're having, specifically when they're either at work, if they're a state government or local government employee, or if they're visiting those buildings during the regular course of their day. So we've really seen this as an area that can make a huge impact, not just for government employees, but also for anybody who visits those buildings, and making the healthy changes there can have the opportunity to actually drive the food supply. If they're such large purchasers at state government or local government, that they can actually make changes to what's able to be offered by the large companies who are fulfilling the contracts within those organizations. And so for the American Heart Association, one of the things that we've done is really elevated this issue of healthy food and beverage procurement to what we're calling a glide path goal, a goal that we are encouraging all of our states and local communities within the country where we have staff based that are working on policy change to focus on this issue area very significantly over the next 3 years. And we'll talk more later in the presentation about some resources we have to offer to that end. But this is definitely something that the Heart Association is seeing as one of the primary policy change opportunities over the next 3 years.
Great, thank you, Ashley. Next slide. And this policy area can be taken on in a variety of different ways, through legislation, through executive orders, which we view as more official policies because they're more lasting change. But it could also be taken on through regulations, having a department policy. So the health department could have a policy for all of the foods and beverages served or sold on their property or through their programs. It can also be taken on through contract work. So if a state isn't able to pass a public health law, they might be able to change contract language to help get healthier foods on their government property. Or, as I mentioned, in Alabama, they don't have an official policy on this, but they do have a healthy vending program. Next slide. And now we're going to hear a little bit more about policy and programs from Julie. Michelle, was she unmuted? Julie, we're going to try to unmute you in just a second. Michelle, maybe while you work on getting her unmuted, we can flip ahead a couple of slides and I can just talk quickly about a study that's going to be released, and then Julie can talk about policy and programs. So, yep, keep going. And the next, yep, back one. Perfect. So I'll talk about this, and then Julie can talk to you all about policy and programs. So at CSPI, we recently did a study which is going to be released next week, and you're the first audience that's hearing about our new study. And we got volunteers from all around the country so that we were able to look at foods and beverages sold through vending machines on state and local government property. We ended up looking at 853 different machines on 260 different types of government property across 37 states. And this covered all the regions of the country. And the types of government property that we were looking at were agency buildings, state universities or community college buildings, state and local parks or recreational facilities, city and town halls, state houses, highway rest stops that are managed by the state and local courthouses, community and senior centers, state and city hospitals, as well as libraries and police stations. Next slide. And what we found was that 42% of the beverage options on state and local public property are healthier options. 16% were water, 23% are lower calorie options, so those are diet sodas, diet sports drinks, and 3% of the options were 100% juice. And looking at this, we can see that with 42% of the options being healthier, it wouldn't be that much of a switch for states or localities to move to 50% healthier options. Looking at the different types of vending machines that there were on state and local property, that would mean only switching between 1 to 4 beverage slots depending on how many different beverages were offered in a machine. So policies around the country that are only requiring 25 to 30% healthy options might not be very effective if the national average already is above that. CSPI recommends that 100% of beverages be healthier options. However, if a phased-in approach is used or politically necessary, a 75% threshold may be more likely to provide meaningful progress from the current national average. Next slide. In terms of food options, unfortunately, the options were overwhelmingly unhealthy. 32% of the options were candy, which was the most prevalent. 24% were chips and 15% were sweet baked goods, meaning that these 3 items overall represented about 80% of the products that were available on government property. About 15% of the options were healthier items, so things like lower fat chips or whole grain options, granola bars, and then about 5% of the options, which is included in that 15%, were actual healthy items, so fruits, vegetables, or nuts. So as we can see, there's a lot more work to be done with foods on government property, which we are happy, all of us, to help you work on. So as I mentioned, this study is being released next week. If any of you would like to incorporate information from this study in a press release to help boost the work that you're doing in your state or locality, we'd be happy to share our press release and share the report early. Next slide. So I just wanted to quickly highlight CSPI's website for healthier food choices on public property. We have a lot of really great resources from CSPI, from the National Alliance for Nutrition and Activity, as well as our partners like the Public Health Law Center and the Heart Association. We also have toolkits. We have that map that I showed earlier. A lot of great fact sheets, like making the case, the business case for vendors is one of those. Next slide. And this is the website here, and that's my email address. If you're interested in getting that study early or the press release, or you have any other questions that aren't addressed in the webinar, feel free to reach out to me. So Michelle, is Julie unmuted now?
Hi, this is Julie. Can you hear me?
Yes.
Great. Sorry about that, everyone. Just a little bit of a mix-up there. I was trying to talk, but it was like, being in a room by myself. So thank you very much, Katie, for all that information. And so just going back a little bit, I wanted to just talk about the differences between policy and programs. As Katie had outlined for you all some different policy approaches that are being taken to implement healthy eating in a systematic way across the community or state. So things like these executive orders, or using contractual policies or organizational policies to do this. Now, our experience in working with this area is that there is a lot of activity that is done in healthy eating through programs, and everybody really has a good handle on that approach and understands how that works. But we're also really seeing that to move the needle on this issue, policy approaches are really important. So I wanted to take just a few minutes to talk about the key differences between policy and programs. And for many of you, I expect that you've thought about this, heard about it. So I hope this will be a helpful refresher for you. But I'm also thinking that there will be some people, there's usually a few, who it's a kind of a newer concept for. So I'm going to start with a basic definition of policy. It's basically something that is in writing and that sets up a framework that's designed to influence and shape decisions and behaviors. Next slide, please. Policies create a rule, and these rules are usually meant to be permanent or semi-permanent, and most importantly, they require a formal process to change. A policy is something that sets principles, that shapes actions, that establishes roles and responsibilities, and that reflects the values and beliefs of a community, but also helps to shape them at the same time. A key point about policy is that these policies are something that apply across a community or a jurisdiction. They're something that impacts everyone because they're part of the community framework. Next slide, please. Whoops, one back. Thank you. So in contrast, programs tend to be much more temporary, sort of time-limited activities. And while they can have a lot of impact, they usually impact mostly those people who are actually participating in the programs or who are carrying out the program. So it's much more of an individual kind of impact as opposed to a wider community change. Now, of course, programs can also change social norms, but to do so, it requires consistent delivery across time, which, as we all know, can be really hard when funding is on a limited basis. Often we see this happen all the time, that the program goes away when the contract or the grant goes away. Next slide, please. So for, I tend to be a very visual person, and so for folks who are more visually oriented, I wanted to provide this Venn diagram to kind of help conceptualize the relationships between the impact of policies versus programs. So you can see that we have the smaller circles in the middle, the programs overlapping with practices or individual behaviors, showing how the programs can change those things, but it's really only those folks or groups who are participating in the programs who are really feeling the effects of those. But policy and systems environmental change wraps around all of this. It wraps around the program, it wraps around the individual, encompassing all the individuals in a community. And so they are because policies are part of the social frameworks or structures around us, they have a broader impact, not just shaping not just behaviors, but also many times driving the programming. And so this illustrates how programs can be really an important part of policy change. Next slide, please. But are not a substitute for it. And so now people often say to us here at the Public Health Law Center, do we really need to have another policy? There are so many rules and policies already. People are just sick of having rules. And, I totally get that. It's important to understand that everybody feels that way about a lot of things. It's pretty typical in its human nature. But it's also really important to keep in mind that there are some very good reasons to deal with important issues like access to healthy foods through a formal policy. So these are two examples on this slide of two different types of policies. One is a tobacco-free grounds policy for a school district, and the other is a healthy beverage policy from a hospital. These policies, when you look at these and you can see these things in writing and you see that they are out there, they're like the sign is promoting awareness and understanding that this policy exists. This is a very important part of policy, that they can promote awareness and understanding about the rules are. They promote fairness. So again, everybody knows what the rules are, and it's something that everybody has to do. It applies to everybody. And formal policies like this make it are much more effective in accomplishing a public health goal, because they often tend to be self-enforcing. Once people understand what the rule is, they generally will follow it. And that also helps to know what the rules are if you're trying to enforce a particular type of practice or behavior. And most importantly, of course, these kinds of policies are more likely to result in lasting and sustainable change. Next slide, please. And so I just spent several minutes here talking about the importance of a written policy, and so I wanted to just step back for a moment, though, and note for you all that writing a policy is actually just really one small part of creating the policies. And in some ways, ironically, it's almost the easiest part, because most of the work that you need to do when you're writing a policy is before you get to that point of writing it down. And it's these steps listed here: gathering your data, engaging stakeholders, collecting samples, again, talking with your stakeholders, getting some help from either an attorney who knows the jurisdiction or a legal technical assistance provider like the Public Health Law Center. Again, talking with your stakeholders, engaging, identifying the deal breakers and anticipating challenges, and most importantly, working on the messaging. And, I know that the public health world has gotten a lot more sophisticated about understanding the need for messaging and doing all these kinds of steps, but it's still really an important step that can be overlooked or underestimated. And on the point of local data, the report that Katie talked about here right before I started is a really great example of some of the kinds of data that can be very helpful in developing a policy. And so, again, it's something that will inform the development of your written policy. And so now I'm going to talk about some legal issues, though. Since I am a lawyer and I'm here to talk about the law, I'm going to move on to that. If you can forward, please, keep going. Right here, thank you. Next slide, please. So we're here talking today about healthy food in public places. And one thing to keep in mind is that when we're talking about healthy food or healthy vending, that can mean a variety of different things. It can refer to like a vending facility, like a snack cart or a bar, or a cafeteria kind of food establishment, or the vending machine, which is what often comes to mind. And any decisions or about what a scope of a policy will be for any of these places is going to be impacted by what type of place you're talking about, and also about your local legal context. And there are, of course, a number of legal issues that will be implicated depending on what type of facility you're talking about. But I'm going to talk just about one kind of legal issue today, and that is the Randolph-Shepard Act. Next slide, please. Now, again, some of you might be familiar with this law, but for some of you, you might have heard the name but not necessarily know too much about it. So I'm going to give you some background about it. The Randolph-Shepard Act is a federal law that was passed about 100 years ago to promote employment opportunities for legally blind individuals. And what the Act does is it gives a priority to legally blind individuals to operate vending facilities on federal property. And so what that means is, by priorities, is essentially it's more than just a right of first refusal, but it's really a right to operate these facilities on federal property, to get income from them, and it's sort of to protect this kind of activity as a source of employment for blind vendors. Next slide, please. So we have written a fact sheet about the Randolph-Shepard Act and how it can impact healthy vending efforts, and talking about some of the lessons learned from communities that have been doing this work. And we're actually in the process that we wrote it a few years ago. There's been a lot of activity since, so we're updating it. And so here's a screenshot of the revised version that should be out by the time of the Southern Obesity Conference. So if you're going to the conference, then you can look for it around that time. So a lot of the information I'm going to cover today, it will be in this fact sheet as well. So next slide, please. Now, what the Randolph-Shepard Act covers is a wide variety of vending facilities. So when they say vending facilities, it can mean a lot of different things, all the things that are listed here. So vending machines, cafeterias, snack bars, carts, shelters, counters, and other kinds of related equipment. So it's a very broad definition. Next slide, please. And what the Act does is it essentially sets up what is called a business enterprise program in every state. And it's usually called that in every state too, a BEP, or business enterprise program. And what the program does is kind of oversee these self-employment opportunities for qualified legally blind individuals. And so the Randolph-Shepard Act provides general guidance about how these programs should be operated. And the Act also requires that in each state there will be something called a state licensing agency that is designated to oversee the implementation of the Randolph-Shepard law and the running of the business enterprise program in that state. And part of the requirements of the Randolph-Shepard law is that there be a blind vendors committee that is made up of representatives of the licensed blind vendors who are participating in the program and who are actively participating in the administration of the program and handling grievances. So they're not just kind of a token group, but they're really involved in how that program is run. Now, which division or department in the state is the state licensing agency can vary from state to state. It can include agencies like the state's rehabilitation agency, or the state's commission for the blind, or the division of blind and visually impaired services. I mean, there's different names for it, and sometimes it's in the Department of Education. So you have to do a little bit of looking to identify them. But what the state licensing agency does is identify locations in the state which are subject to the Randolph-Shepard Act and which would make good vending locations. And as well, I'm going to get into this in a moment, but as well look for locations that might be subject to the state's version of the Randolph-Shepard Act, and then go about trying to get a blind vendor placed there to do business. Next slide, please. So I mentioned that the state licensing agencies can be housed in different agencies. Here's an example of two different, departments or in two different states where you could find out more about the Business Enterprise Program. Next slide, please. And just in general, the National Council of State Agencies for the Blind maintains a directory of the state directors of these programs. And so if you can easily go to this website and just click on your state and figure out who would be your first point of contact. And the reason I'm spending some time talking about how do you get a hold of these folks is because they really are, in these healthy vending efforts or healthy food efforts, they really are very influential. These business enterprise program directors, as well as the members of the blind vendor committees, they are very important stakeholders in any kind of public property healthy food movement, and they need to be involved in some way. You need to be connecting with them about what you're doing. Okay, next slide, please. And just a couple more points about the Randolph-Shepard Act. I mean, why it creates so much leverage for blind vendors is that in addition to this process where the state licensing agency and blind vendors get kind of this right of first refusal to operate on government property, it also sets up some protective mechanisms so that before the agency can work with a non-blind vendor, they have to actually get a written waiver from the state licensing agency saying that they can do this. And then if there are places where there are non-blind vendors who are competing directly with blind vendors, then a percentage of their sales, those sales have to go to support the business enterprise program or a blind vendor or the licensing agency. Now, next slide, please. I alluded to the fact that that many states, in fact, just about every state, except for North Dakota and South Dakota, have their own version of the federal Randolph-Shepard Act. And so these are state laws. They're often called mini Randolph-Shepard Acts. And what they do is they take that preference or priority for blind vendors on federal property and apply it to state property, and sometimes even to county or city property. And so for the American Heart Association, we've been doing a 50-state review of all of these state laws, these mini Randolph-Shepard Acts, and to analyze and compare them and see, how they're similar and how they're different. And so created a map. Maps are great tools to start helping the world to understand how these work. Now, we're going to be making this research available to the public sometime in the near future, but in the meantime, please, if you have questions about your specific state or area, please feel free to call me. Now, I want to just explain the map a little bit. So the light blue areas are those states where the law says that the priority for blind vendors applies only to state property. The dark blue states are the ones where they have extended the priority not just only to state property, but also to certain local government property. And it can vary from state to state. Some states it's just counties. Some states it's counties and cities. So again, that's a very state-specific question. And then the pink states, you see the dark pink states are North Dakota and South Dakota. Those are the only two states that have only the federal preference is in place. But one thing to note about South Dakota is that there is actually an executive policy that says for state agencies, they should make an effort to contract first with blind vendors. So even it's not a law, it's not in part of the South Dakota statutes, but there is an executive policy that urges agencies to contract first with blind vendors. And then Arkansas, that one state, is a little bit unclear. We're trying to figure out exactly what is the scope of their state Randolph-Shepard law. So we're continuing to refine this and also trying to figure out ways to represent some of the more nuanced information. So for example, like in California and Minnesota and some other states too, but there's language that doesn't require the priority at the city or county level to be given to blind vendors, but says things like we encourage it or you should be promoted. And so trying to understand how is that encouragement language applied on the ground is an important piece of this. All right, next slide, please. So there are a lot of groups that provide support to blind vendors that are participating in these business enterprise programs. Here are some examples of the key national advocacy organizations, so as well as the state commissions for the blind, and then there's also usually local business trade associations and local trade groups that offer resources to help the blind people achieve economic and vocational independence. And the national advocacy groups tend to be can be very vocal and very active in healthy vending efforts. So the groups like the National Association of Blind Merchants and the Randolph-Shepard Vendors of America, because they provide a collective voice for the business enterprise program participants. And often these organizations, as you would expect, like many vendor groups, are really wary about laws or policies that they believe could keep blind vendors from fully benefiting from the Randolph-Shepard protections. And so this has meant that in some instances, blind vendor merchants have used their lobbying power and their political influence to hinder state and local efforts to pass healthy vending measures that they think are going to negatively impact them, by reducing their profits or affecting their businesses. Next slide, please. So just briefly, two examples. Katie talked about a number of actual policies that have been passed, and these are two examples where showing different ways that state groups have tried to work with blind vendors with varying degrees of success. So, in example, in Tennessee, this executive order was passed in 2010 that requires some nutritional standards for vending machines on state executive branch properties, and the executive order requires that blind vendors be part of the group that was deciding these standards and working on this. And that is an important step. But when groups in Tennessee were trying to actually improve the standards then and reach for a higher standard, then the Tennessee Blind Vendors Group really came out in opposition and caused some controversy, and it ended up that they settled on, they did improve the nutrition standards eventually, but instead of going for a 50% standard, which had been the original goal, it settled at 30%. Now, in the Washington case, which came around at the same time that the Tennessee order was updated, Washington passed an executive order requiring, as part of the larger worksite wellness initiative, requiring nutrition standards be implemented for a variety of settings in the state. And again, the executive order didn't specifically require that blind vendors be part of the task force that was setting up the standards, but the chairs did involve the blind vendors, had two representatives from the Division of Blind Services and the committee, and ended up when those representatives were sitting in these meetings and seeing that the Department of Corrections, which is a very influential purchaser, was on board and was moving ahead, it ended up persuading them that they needed to support this and go along with it. So these are sort of two examples of pathways. Katie was going to talk a little bit about Oklahoma.
Sure. So I just wanted to briefly mention two other really great examples of having good conversations with the blind vendors. In the policy that I mentioned that was passed in DC, the blind vendors actually spoke at the hearing testifying in support of the legislation that they were trying to pass, which was eventually passed. And I've heard about some very encouraging conversations that have been going on in Oklahoma between advocates and the blind vendors about the blind vendors being really open to trying to have healthier options.
Thank you. Can you hear me again?
Yes.
Okay, good. I just wanted to make sure. So it's definitely an evolving world, and so, but it's just important to know that you have to think about these issues and think especially about the blind vendors and how to engage them to try to make the road is going to be bumpy enough, and so to try to smooth it as much as possible, engaging these stakeholders is very important. Next slide, please. So here are just a few resources that can support those kinds of efforts. And Katie mentioned the CSBI website, the Healthier Food Choices in Public Places, which has actually the most comprehensive collection of resources that I know of on this issue. But here are some examples of some other ones, and a screenshot of the study from Chicago that just came out, which I hope will be really helpful for people in addressing some of the revenue concerns. Next slide, please. And so before I turn it over to Ashley to talk about the great work of the Voices is doing and supporting in this area, I just wanted to give you a little bit of a walk through our website. We also, of course, have resources. We have new publications on healthy eating that are coming out and adding every month, including that Randolph Shepherd fact sheet, which will be coming out. So you can, if you go to our website at publichealthlawcenter.org and you click on the healthy eating page. Next slide, please. And you look to the right and you see the list of subtopics, and there's healthy vending right there. You can click on that and that will take you to our healthy vending page, which has a variety of resources. Next slide, please. So I just want to leave you with my contact information. Appreciate your time, and it's fantastic to be working with such great partners at CSBI and the American Heart Association. And now I'm going to turn things over to Ashley.
Just real quick before Ashley gets started, if anyone has questions, you can type them in. You should have a control panel on the right side of your screen. And if you would type those in when all three of our presenters are done, we will try to get to all those any questions that you might have. Thanks.
So next slide, please. Okay. Hi, everyone. Good afternoon. This is Ashley Bell again, and I work for the National Office of the American Heart Association, but I've also recently joined the Voices for Healthy Kids team within the American Heart Association. And so my role here is to provide support and guidance to AHA's 80+ government relations staff team members across the country on a wide variety of policy issues, but most specifically for this call, obesity prevention issues. And most relevant to what we're talking about today, that includes healthy meetings, healthy vending, and service policies, for which we've all been using the term procurement. So as mentioned previously, healthier foods and beverages is an area that the American Heart Association has prioritized as one of the most important policy change issues we can affect in the next few years. And here at AHA, multiple functional units and project teams within the organization have actually prioritized this work within the work that they do. So it's not just the advocacy team prioritizing it from the policy change perspective, but also our Health Equity and Multicultural Initiatives team is prioritized working in churches and other community locations around healthier vending, healthier meetings, where they have opportunities for prepared and served meals as well. So there are multiple groups looking at this issue area, but today I'm going to share with you information about two of the initiatives within the American Heart Association and share further information with you about where you can go to find more information if you have interest in these issue areas. So next slide. Voices for Healthy Kids is a joint initiative of the Robert Wood Johnson Foundation and the American Heart Association, and we're working to help all young people eat healthier foods and be more active. We seek to reverse the nation's childhood obesity epidemic by 2015. Voices for Healthy Kids is a unique collaboration that leverages collective resources of the childhood obesity movement to strengthen and support advocates by advancing evidence-informed childhood obesity policy at the state and community level. We seek to reverse the childhood obesity epidemic by 2015 through public policy advocacy. To succeed, we'll need involvement at every level, from partnerships with national organizations, state and local coalitions, and individual advocate participation. That's where you come in. Many of you are already working on the procurement issue within your state or local community. Today, we wanted to share information with you about resources we have available to help support your work. Next slide. Before we get into that, let me give you a little bit more background on how the American Heart Association approaches our policy priorities. Before I joined this National Center team at AHA, I worked in the field in several states within the Southern Obesity Summit region. I lobbied for the AHA in Georgia, Mississippi, and North Carolina, so I know the political and societal climates many of you are experiencing. One of the things I have always loved about working as a lobbyist for the American Heart Association is the fact that all of the policy positions we take are based on scientific research, and we can always feel confident that our position is not swayed by external factors or more specifically by political pressure. Many of the policy approaches we are focusing on in 2014 and 2015 are based on the scientific statement that's linked here in the slide. That scientific statement, the population approaches to improve diet, physical activity, and smoking habits, was a scientific statement from the American Heart Association led by Dr. Darius Mazafarian. Excuse me, I always have a hard time pronouncing that name. And the statement says that poor lifestyle behaviors, including suboptimal diet, physical inactivity, and tobacco use, are the leading causes of preventable diseases globally. Although in modest population shifts and risk substantially alter outcomes, the optimal population level approaches to improve lifestyle are not well established. For this American Heart Association scientific statement, the writing group reviewed and graded the current scientific evidence for effective population approaches to improve dietary habits, increase physical activity, and reduce tobacco use. And this review identified and graded the evidence for a range of population-based strategies to promote lifestyle change. The findings provide a framework for policymakers, advocacy groups, researchers, clinicians, communities, and other stakeholders to understand and implement the most effective approaches. New strategic initiatives and partnerships are continuously needed to translate this evidence into action. Next slide. And that's part of where Voices for Healthy Kids comes in. It is a new strategic initiative that is very focused on childhood obesity. For our work in Voices for Healthy Kids and childhood obesity issue campaigns, we are creating an initiative that builds skills and provides opportunities for state and local advocates to move policy across the nation. We've organized the work into 6 hubs, and there are multiple evidence-based policy issues under each hub. Aligning our work into the 6 hubs allowed us to partner with 6 organizations already seen as experts in their respective issue areas. For purposes of this call, the most important is the Marketing Matters Hub. For the Marketing Matters Hub, we have partnered with the Berkeley Media Studies Group. And I should also mention that we've been working very closely with my co-presenters on this call at the Public Health Law Center and the Center for Science in the Public Interest. Katie and Julie have both been invaluable resources to provide technical assistance and better inform the work being done in states and communities. And I think you'll see over the course of our presentation today that we each have specific areas we're focusing on and that we can help provide technical assistance on. Next slide. The purpose of the Marketing Matters Hub is to increase incentives and demand for strengthening industry self-regulation and government regulation of food marketing to kids. So that's the overall purpose. Within the Marketing Matters Hub, we have 3 established policy levers or issue areas of focus. They're restaurant marketing, where the goal is to ensure all restaurant meals marketed to children meet nutritional standards. School marketing, where the goal is to eliminate marketing of unhealthy foods and beverages in schools. And healthy food procurement, where the goal is to promote healthy food and beverage vending and service on government property. Next slide. Within the healthy food procurement policy lever, we have organized our work into 3 areas of focus at the state and local level. Those are vending, service, and feeding of custodial populations. Here it's called institutional feeding. Within each of those 3 areas, we'll be encouraging the use of one of 3 sets of standards. The standards are the American Heart Association standards, the U.S. Department of Health and Human Services, GSA administration standards, or the National Alliance for Nutrition and Activity. And obviously Katie and Julie have both mentioned those 2 sets of standards and where resources can be found. Each of these sets of standards is a variety of supporting materials. You'll be able to find materials in support of the HHS GSA standards on the Centers for Disease Control website. You can find a toolkit and resources to support standards created by NANA on CSPI website, which is linked there in Katie's final slide. Next slide. For American Heart Association resources, you can go to our website, which is heart.org/food where you are. So for the American Heart Association website and the Healthy Workplace Food and Beverage Toolkit, this is actually something that we've just released this summer. And it shows the healthier choices that can be made from a nutrition, tobacco-free, physical activity perspective, and even sustainability. And the great thing about this toolkit is that it offers lots of really good resources in terms of optional choices, things that you could choose that would be the healthier option. We found it to be a really great resource, just as we're planning meetings in our office. I know I was working on a vending contract recently where I shared the information about we have to meet these standards, and they've been working to come up to that level of those standards. And I was also planning a meeting recently where I sent the information to the caterer so that we could make sure we were meeting our own internal standards that we'd set up for working to host meetings in our own offices. So it's something that we are really working on practicing what we preach. Next slide. So the other reason that we have really chosen to focus on procurement is the potential that we think that it has to impact the sodium amounts that people are getting in their daily diet. And so to that end, we are pairing the work we're doing in procurement with the work that is being done by our sodium team. We have a team called the Healthy Living Team here at the American Heart Association, and we have a staff person, Emily Ann Miller, who's leading the work there. And she shared this information with me about the Sodium Reduction Leaders Community. It's an online private community that was launched earlier this year to promote cohesive messages about the importance of sodium reduction and serve as a channel to share those messages, materials, and insights regarding emerging science and news with other proponents of sodium reduction. So it's really meant to be for the people who are really working in sodium reduction in their community. So if you'd like to request access to that site, you can click on the link there in the slide and join the community. Just to reiterate, the sodium, all of the set of standards that we're looking at for procurement that we're encouraging states and local communities to work on have pretty detailed information about how much sodium should be in beverages or in the snack or in a meal. So having sodium resources to support that and the information that's shared within this community is really important to the procurement work, because that is definitely one of the first policy change areas that we see that could really bring about a change in the amount of sodium Americans are getting in their diets. Next slide. So this is just a screenshot of the Sodium Reduction Leaders community. Sorry, it's a little blurry. I'm not all that adept at clearing things up once I pull them from somewhere like that, but that's a technology issue, my fault. But it does show the sodium reduction community and just an example of what, if you go to that link and request access, what you would be able to see in terms of social media messaging, resources that have been posted, and the latest and greatest content. And again, the website is there in this slide if you would like to, in the previous slide, if you'd like to join that community. Next slide. So transitioning back to Voices for Healthy Kids for the final few slides. Now I can tell you more about applying for funds to support a healthy food and beverage procurement campaign in your state or community. The goal of these grant opportunities within this initiative is to make effective strategic investments in ongoing state, local, and tribal public policy issue campaigns in order to increase public policy impact on healthy weight and living among children. Voices for Healthy Kids is focusing efforts on our 6 priority areas, and applicants should make sure that their applications are linked to each within these priorities. 26 coalitions have been funded to date. 3 types of grant opportunities currently exist within Voices for Healthy Kids, and they're listed here. The Open RFA, which is the Strategic Campaign Funds, or Open RFA opportunity, aims to fund strategic issue advocacy campaigns focused on fighting childhood obesity through state, local, and tribal public policy campaigns. The duration of these grants will vary, but will generally be 1 year or less, and awards can be made up to $90,000. Applications must be specific to an individual campaign, goal to change public policy in one state, local, or tribal geographic location, and must align with one of the 6 Voices for Healthy Kids policy hubs or policy levers. And budgets can include 1 campaign coordinator position and a legal contingency of no less than 5% of the operating budget, as well as matching funds on behalf of the applicant. Rapid response grant opportunities, which is at the end there. Sorry, I'm a little out of order, but rapid response grant opportunities aim to fund short-term reactive projects expected to be pushing policies for passage in the next 3 to 6 months and must align with one of the 6 Voices for Healthy Kids policy priorities. These grants provide strategic and supplemental funding for ongoing state, local, and tribal public policy issue campaigns. Rapid response awards range from $15,000 to $100,000, and project duration is anywhere between 2 weeks to 6 months. Funding is for non-lobbying activities only and must include a legal contingency and cannot be used for staff salaries. And then the third is the strategically directed tools, which are award opportunities that are intended to support lobbying activities related to a strategic issue advocacy campaign focused on childhood obesity at the state, local, and tribal level. Now, I should stop here and just point out that the money for lobbying campaigns is not from, it is actually from the American Heart Association. It is not funded by the Robert Wood Johnson portion of the project. So the American Heart Association is amplifying the work that we're doing within Voices for Healthy Kids by adding in lobbying dollars that are specific from AHA. So I just want to be clear that there are two sort of pots of money that we're pulling from here, and that the Robert Wood Johnson funds are not used for lobbying. Next slide. So applications and campaigns must align, as I mentioned, with the Voices for Healthy Kids policy priorities or policy levers. And the funding requests, again, range from $20,000 to $80,000 maximum, and the duration of the grants will vary. If you're interested in applying or have additional questions about any of these tools, you can email voicesforhealthykids.org, or you can click into the link in this slide. The good news is that the healthy food and beverage procurement issue was just added in the second year of the work of Voices for Healthy Kids initiative, and campaigns within this area are eligible to apply for funds as of June of 2014. If you're on this call, you may already be aware of the work going on in your state or local community, but if you're not sure and you would like more information, you can reach out to your American Heart Association Government Relations Director in your state, or you can go to voicesforhealthykids.org or email me at ashley.bell@heart.org. For the contact information for the right person in your state, you can click into the link in the bottom of the last slide and scroll down to your state, where you'll find email and phone contact information for our government relations staff teams in your state. That wraps up my presentation, and I'll turn it back over to Katie to show a bit more information. Next slide. I think there's one more.
Just one more slide. So I just wanted to mention that Julie, Ashley, and I will be having a call on October 28th for people that are working in this topic area or would like to start working in this topic area, covering the whole spectrum of different types of policies that you could cover: vending, cafeterias, concession, and institutional feeding. And we're hoping to have this be a regular call where people who are working on these policies would be able to bring questions or talk about successes or challenges. So here's the information for the first call. If you have any questions, feel free to reach out to me. And Julie or Ashley, did you want to add anything?
Nope, that sounds good. We're just hoping people will want to call and share their stories and questions.
Great. Yeah, I'm not seeing any questions. Does anybody have questions for our presenters about any of the information they've shared today? You've done a great job of doing 101 on everything. Thank you so much. It's a lot to absorb. No questions? We have a quiet group today, or is my questions not working? I did get one question earlier about where to get the slides, and we have been recording the presentation, and we will be posting the webinar, and you will have an opportunity to review it or share with other people. I will check with my presenters on posting the PowerPoint as well. No questions? Well, I want to thank all three of you, Ashley and Julie and Katie, for sharing your information, and I'm real excited about the fact that you're setting up these regular calls. I hope that many of you are coming to the Southern Obesity Summit, and we'll be able to connect with these fabulous ladies there, and also with others in the states across the South who are working on this issue. So hopefully we'll see you there, and if not, please repeat when the Randolph-Shepard Act fact sheet is due out, and can it be spent? to attendees.
Yes, absolutely. I just want to confirm you can hear me, first of all.
Yes, definitely.
Okay, good. Sorry, I'm a bit paranoid now. It's in graphic design and being reviewed, so I'm planning to have it out by the time of the conference, and I would be very happy to send it to you, Michelle, to send out to all the people who sign on for the webinar.
Great, perfect. Would love to be able to distribute some of those at SOS, and also be happy to send electronically if possible.
Okay, great.
Okay, well, I don't see any other questions. So thank everyone for attending, and we will end the webinar.
Great. Thank you.